cancer treatments are ongoing, right? And there are speculations that vaccines to cure cancers are on the cards. Are we going to finally get a cure for cancer?
Well, you see, when you said cure, it's a relative term, really. Do we have cure for diabetes? Do you have cure for hypertension? The answer is literally yes and no. When you have a chronic disease that you can actually live with for 20, 30, 40 years, I mean, it's almost as good as cure, right? You are taking your treatments and then you do your normal things every day. So it's as good as cure. Yes, we have reached that level as far as cancer care too is concerned internationally. Now, if you ask me, is it specifically in Nigeria, are we curing cancer? The answer also is yes and no. If you can afford certain drugs and certain medications, yes, cancer can be cured. But majority of people cannot afford those type of treatments. So yes, cancer can be cured, and cancer also cannot be cured. Sorry?
But not affordable, and that's why one would be wondering,
yes,
why cancer out of pocket? Why can insurance not cover the treatment of cancer?
Well, I'm not the spokesperson of the government of Nigeria, so I'm not really in a better position to answer that. But I do know that some part of cancer care is being reimbursed by the National Health Insurance Authority. So it is reimbursable. But the question is, how many Nigerians are on insurance? So that's about, we have less than 5% of Nigerians that are on NIA, on the National Health Insurance, less than 5%. So if you look at 5%, that is grossly inadequate. And also government had set aside certain fund called the National Cancer Health Fund that is supposed to support indigent patients that have either prostate cancer, breast cancer, and cervical cancer, just the three. Because the three cancers account for over 50% of the cancer burden that we have in Nigeria. But again, the fund is grossly inadequate when you look at the number of patients. And that is why the statistic has not changed in the last 10 years. Our statistics has not changed vis-a-vis incidence and mortality. Statistically, if you look at what is obtained in the Western world, it is projected that cancer incidence will come down by about 70%. By just 2030, it will come down by about 70%. But in low and middle income countries such as Nigeria, it's projected that it will even go higher by about 70%. And that is because what we need to do are not being put in place. And that is the honest truth. It's not being put in place. And you will ask yourself, what are those things that should be put in place? Number one is screening, national screening programs. We have them on paper, but they are not institutionalized. We must institutionalize them if we want to change the narratives, so that we will have early diagnosis, because late diagnosis is one of the key reasons for high incidence of mortality. And the other important thing is abandonment of treatment. A lot of patients will start treatment, but they will abandon it along the line because of financial toxicities. Patients simply cannot afford treatment. And with the economic downturn of many families in this country, it is almost impossible to get treatment for cancer. Unless something drastic is being done, it is not likely that we will achieve anything meaningful as far as cancer care is concerned?